So my name is Sindhu Ramchandren. I am a neurologist by training, and I currently work as a clinical leader in late phase development at J&J. My background in myasthenia, so in my prior life, I worked in academia and I used to take care of patients with rare neuromuscular disorders, including myasthenia gravis. So myasthenia gravis is a rare autoimmune disorder. It affects approximately 700,000 people worldwide, about 100,000 people in the US. It's a disease where the IgG antibodies that your immune system normally makes to fight off infection goes awry and it starts attacking self. So in myasthenia gravis, these antibodies attack the neuromuscular junction, which is the place where the nerve is communicating with the muscle. When that happens, muscles do not function properly, so they fatigue easily, and you cannot do normal activities that require muscles, including things like speaking, breathing, swallowing, walking, talking. All of these are affected in myasthenia gravis. It affects about 85% of patients with generalized symptoms as opposed to just ocular symptoms. And about 20% of these are patients who are women of childbearing potential. Another 20% of patients will experience what's called a myasthenia crisis, where they have acute weakening of the muscles that control swallowing and breathing, and they need to be emergently hospitalized and intubated to protect their airways. So this is a very highly impactful disease, and currently there's still an urgent need for faster, more effective medications that can treat myasthenia gravis. This is where Nipocalimab potentially comes in. So Nipocalimab is an investigational therapy that we have developed, designed specifically to substantially reduce this pathogenic IgG, these autoantibodies that are causing the disease process in myasthenia. So Nipocalimab binds to a receptor called the Fc neonatal receptor, or FcRn. The FcRn is this receptor that's ubiquitous in our body. It works to recycle IgG, which in normal circumstances is good. It's very energy efficient, but it also recycles these pathogenic autoantibodies. So what Nipocalimab does is it binds to the FcRn receptor, blocks that recycling, and thus lowers the levels of IgG, including the pathogenic IgG, which can then result in improvement in symptoms. So this is what we looked at in our adult Vivacity-MG3 study to see whether reducing the IgG, including the pathogenic IgG, can result in improvements in clinical manifestations of MG, including a scale called the Myasthenia Gravis Activities of Daily Living, or MGADL, as well as another scale called the Quantitative Myasthenia Gravis Scale, or QMG. So the MGADL scale is from the patient's perspective. The patient says, how does the MG manifest in their daily lives, and how are they able to do their activities of daily living? And the QMG is a physician scale. So the QMG, the physician does a standardized exam to see how severely does MG impact the patient. We also looked at a adolescent study, the Vibrance phase 2/3 study in adolescents with MG. And in that study, we looked at a pharmacodynamic endpoint. We looked at the IgG levels directly to see, do we see that reduction in IgG levels that then also translates to improvement in MGADL and QMG. We have presented the results of the pivotal study before. At this year's AAN, we have a total of, I think, 12 abstracts that we presented, which included an oral presentation on the QMG and the improvement seen in the QMG during that double-blind phase of the Vivacity study. So the oral presentation shared that during this double-blind phase, we saw approximately a 4 times greater odds of improving and maintaining that improvement in the QMG when you're on Nipocalimab as opposed to placebo on top of your standard of care treatments. And we also presented new data that demonstrated the long-term efficacy and the sustained efficacy of the results with Nipocalimab. So the MG-ADL, QMG, and IgG reduction that had been previously observed and reported during that double-blind phase, we noted that these were sustained for more than an additional year in the open-label extension phase. And in addition, this was really important. We showed that about 45% of the patients who were on steroids when they started the study were able to reduce their steroid dose. And on average, in that group of patients, they reduced it by over 50% of what their steroid doses were on starting. And this is very meaningful to patients. Steroids are associated with lots of adverse events, and one of the goals of many physicians is to lower steroids or background therapies on a patient with myasthenia. So with our molecularly unique molecule and that sustained dosing that we do, we were able to achieve the sustained efficacy that continues well over a year into the open label extension. Finally, we also presented some data on real world evidence where we looked at what are the continued unmet needs in GMG, and especially in women, because recall how I said 20% are women of childbearing potential in this autoantibody population. And we found that individuals who were pregnant received fewer GMG treatments on average. However, they were more likely to experience an MG crisis, which, as we talked about, is this very scary event in a patient's life where they have to be intubated to manage their airway and secretions. So really, there is this continued urgent need for better options for women of childbearing potential, especially in myasthenia gravis. I think the take-home message is that we have shown now that Nipocalimab continues to show sustained disease control without symptom relapse in a long-term patient population, including a broad population of antibody-positive patients, including AChR, MuSK, and LRP4 positive patients. This is one of the broadest populations studied with an FcRn blocker, and this length of double-blind placebo-controlled phase is also one of the longest that has been looked at for an FcRn blocker, continuing on now into this open-label extension phase. So I think this provides more information to providers on the safety and efficacy of the molecule with continued dosing, especially when it comes to reduction of background medications, which is something that's very important to these providers. I think overall, I just want to share that this is just personally, as an academician who previously saw these patients, it's just a very exciting time, I think, for rare autoantibody disease patients to see this significant unmet need being met with so many different options now, where patients really have a choice of understanding the benefits of various treatment options and coming up with the right treatment option for them. I think is a really exciting time. And I think Nipocalimab's mechanism of action has that potential to really address the target cause of many of these autoantibody diseases, which is really, really exciting.